Then the female offsprings were sacrificed at 3 months of age, 10 per treatment group. The pelvic organs with these animals were collected and blocked, analyzed by histology and immunohistochemistry. These are the number of animals that we used. And these are the abnormalities we found in the males treated prenatally with BPA. Pathology of the ovaries, but we will see this better in the following slides. And then pathology at the level of endometrium, adenomatosis hyperplasia and atypical hyperplasia. We did not find cancer of the uterus, but this could be explained by the fact that we sacrificed the mice young, at less than 2 months of age. There are papers that describe tumors of the uterus, but they sacrifice the mice something like 10, 12 months, when the mice are almost at the end of their life. And then, what we found? We found what we call endometriosis-like structure in these animals. What are these endometriosis-like structure we found? Here we have the histopathology, endometrial cystic hyperplasia, atypical hyperplasia endometrium. This is an adenomatosis hyperplasia, ovaric cysts. But what is more important, we found this structure in the adipose tissue surrounding the genital organs of these mice treated neuter with BPA. Look here, it's glands with stroma, glands with stroma, glands with stroma. Very suggestive, very similar to what is the normal appearance of endometriotic ectopic tissue in humans. This is a little spot close to an ovary. This is the magnification. This is a very, very similar to an endometriotic cysts. Here another group of glands. We performed some immunohistochemical stainings in order to see if this structure were similar to the normal endometrium, and indeed this is the endometrium. They express estrogen receptor, and they express OX10, that is a gene very important in the development of the uterus. Then we went to analyze deeply the ovary of these animals. And what we did? We just did morphology. We looked at the number of primordial follicles, developing follicles, and arthritic follicles in the ovaries of these different animals. It's the control, animals treated with BPA 100 and 1000. And as you can see, the number of primordial follicles is lower in the treated animals, like the number of developing follicles, while we have a higher number of arthritic follicles. So the treatment with endocrine disruptor cause also an alteration in the ovaries of these animals, and this could account for the infertility problem that we have in endometriosis. Indeed, if you match all the animals that have the endometriotic phenotype and divide from the animals that do not have the endometriotic phenotype, you see that the pathology of the ovaries is more important. So the number of primordial follicles is less, like number of developing follicles. These are examples of the ovaries from the control, from the treated animals. They are also smaller than the ovaries of the treated animals. So, which are the conclusions? I try now to summarize all what we have shown. Endometriosis is present in fetal life. Moreover, in utero exposition to BPA in an animal model is able to induce an endometriosis-like phenotype in mice. So, we suggest that endometriosis should be considered a developmental disease caused by alteration in the correct axial development of the Mullerian system during a critical period of embryogenesis, by change in genetic epigenetic programming caused by abnormal estrogenic impulse, acting logically on a favorable genetic background. Not all the animals treated with bisphenol then have endometriotic structures. So there should be also a favorable background. Then, if you go to the ovaries, In the ovaries of the BPA treated animals, the number of prenatal follicles and of the developing follicles was significantly lower than in untreated animals, while the athletic follicles were higher. Moreover, the animals displaying endometriosis-like phenotype had a more severe impairment of the ovaries in terms of number of prenatal and developing follicles. So, the final conclusion. Endometriosis, as well as ovarian disruption, should be included in the complex of disorders caused by in-utero exposition to endocrine disruptors that will affect the reproductive health performances during the adult life. So what we propose? We propose to frame all these congenital alterations of the female genital system in a kind of syndrome. We discussed with Pietro about this, saying why this is a syndrome. So that would include endometriosis, progression of ovarian failure, infertility, precocious menopause, and then associated with symptoms such as headache, pelvic chronic pain, all the symptoms that we will know that are linked to endometriosis. And it could be named syndrome of the ectopic endometrium. So, which is our idea? Our idea is that endometriosis is a developmental disease that can be caused by subtle alterations in estrogen pathway, and these alterations include not only the fact that you have ectopic endometrium, but you have pathology, alteration in the endometrium that is not very effective in receive the embryo, that have alterations in the ovary. That's why we think it to be a syndrome. And this is a conclusion, and these are all the groups that have collaborated for our work. Thank you.
Thank you, Professor Baldi. And now, Professor Brian Dale, mitochondria, difference of mitochondria, about the age in the oocyte.